Katz Careers, School of Limited Medical Radiography. This is a textbook. The textbook was written by Katz School of Limited Medical Radiography for classroom purposes. It is copywritten material, and no part of this book may be duplicated for any reason. This book is the property of Katz Careers, LLC. If you would like to purchase a copy of the textbook, please go to our website, and you can visualize the books in the bookstore. Introduction. The programs that Katz Careers offers are limited medical radiography with the focus in podiatry, chest, or chiropractic. Katz Limited Medical Radiography program is offered in the classroom and online. It is designed to assist physicians, medical practices, medical facilities, and chiropractors in training current medical facility personnel in the area of limited medical X-ray. Graduates will receive Indiana Limited Medical Radiography licensure in the program of your choice: chiropractic, podiatry, and/or chest. The prerequisites for medical assistants: high school diploma or a GED, and you must be affiliated with a licensed practitioner or a chiropractor. This is also true for chiropractic assistants. You must have X-ray equipment on site to take the online program. Fundamentals of healthcare. We'll cover that in a minute in the program. Medical terminology, that's basic terminology which you can obtain on the job. Anatomy and Physiology 1, which is basic also, and you can obtain that on the job. The X-ray programs are 16 weeks in length, 8 weeks of classroom instruction, and 8 weeks of clinical rotations. The curriculum for the program: CPR. You can have that prior to enrolling, or we can arrange for that to happen also. Medical Terminology 2, Anatomy and Physiology 2, which are both skeletal related. Patient Care and Management, Radiation Protection and Radiobiology, Imaging Equipment and Operation, Quality Control and Radiation Production, Image Production and Evaluation, Radiographic X-ray, which are the procedures for your specialty. And then you will receive your Indiana Limited Podiatry Radiography license, or chiropractic license, or chest. Let's cover the curriculum in detail. Fundamentals of healthcare. Ethical and legal aspects. We are going to cover HIPAA, patient's rights, informed consent, confidentiality, patient's bill of rights, legal doctrines, and professional ethics. These all are prerequisites. You should have already had all of this training in your current job or in previous medical courses. If you have not had all of these areas, please inform your instructor. We can make sure that you meet the prerequisites. Interpersonal communication. Modes of communication, challenges in communication, and patient education. If you are in the medical field, you are performing patient education. Every time you give the patient instructions on procedures, that is patient education. Medical terminology classes. 1, it's a prerequisite. 2, we're going to cover the skeletal system only. Anatomy and Physiology 1 was a prerequisite. 2 is skeletal related. The next page covers the prerequisites for medical assistants. You must have prior training in medical billing, medical office clerical, clinical, EKG technician, medical office lab, and you must work for a medical office or a hospital. Your physician or practice can sign a waiver which does indicate that you have met all of these requirements. Chiropractic assistant. You must have medical billing, medical office clerical, chiropractic technology, and once again, you must be employed by a chiropractor. Patient care and management classes. Infection control, which is body substance isolation, BSI. OSHA regulations, cycle of infection, standard precautions, additional or transmission-based precautions. And those diseases are hepatitis B, HIV, rubella, tuberculosis, disposal of contaminated materials, and we'll cover this more in detail. Physical assistance and transfer. That is learning to move the patient from one area to the other. The patient is escorted to your area in a wheelchair. You need to be able to know how to transport the patient to the X-ray table. Medical emergencies. How to deal with allergic reactions. Cardiac and respiratory arrest. Everyone has to be CPR certified. We will cover physical injury and trauma, and other medical disorders such as how to handle seizures, diabetic reactions, etc. For the X-ray course curriculum, the actual specifics for radiobiology and radiation protection, biological aspects of radiation, radiosensitivity, somatic effects, carcinogenesis, reproductive, which may cause sterility, systemic responses, embryonic and fetal risk, and genetic impact. We'll get into all of these in detail later, but you need to make sure that you understand that it is very important to handle all patients carefully and to make sure that you take care of yourself responsibly. We don't want to overexpose anyone to radiation. If a patient may be pregnant or is pregnant, we want to make sure that we take the necessary precautions for shielding. If you are pregnant as an employee, then you must take precautions, and we'll get into more of that in just a second. Minimizing the patient exposure. Exposure factors. We want to make sure that we protect the patient, as I said. If there is a male patient, we want to make sure that we provide gonadal shielding, which covers the growing area. If the patient is pregnant, we want to make sure that we cover the stomach area if necessary. And we also want to make sure that if the patient may or may not be pregnant, and you want to ask the doctor to make sure that the X-ray is necessary, and the physician will actually weigh the cost versus benefits factor. We are going to cover beam restriction, filtration, exposure reduction, image receptors. Image receptors are the X-ray film on the cassettes. You will see a lot of big words, but we will actually break those down for you. Personnel protection, sources of radiation exposure. We want to make sure, like I said, that you understand where the radiation is coming from, how to minimize your exposure during the procedures. Basic methods of protection and the different protective devices. Radiation exposure and monitoring. We want to make sure that you understand the units of measurement, dosimeter, NCRP recommendations for personnel protection, and we just want to make sure that you understand all of the precautions that are involved in dealing with radiation.